thanks for that, Annette.
Pleasure. I'm going to be keeping that on the board because I'm going to refer to it from a slightly different angle now. And I've given you all just a very brief handout with some notes on it, some of which I'm going to cover. And I want to introduce it by telling you about this bit at the top, because I'm part, or leading rather, a faculty-wide project in nursing, pharmacy, medicine and human life sciences around global perspectives and cultural competence. Now, cultural competence is a problematic term. I have issues with it myself because it's not something that you can tick off and say you are, because it's like an evolving something that you grow to be with different experiences. So because in the health literature generally, it is a term that, and the reason we're using that term with this in association with this project, is it's because that is the terminology that's in all the health literature. So in our teaching now of the students in the what we call a Global Perspectives module, is we actually qualify our definition of what we mean by that, and it's those 4 things that I've put at the beginning of these notes. So what the students are now doing, all the healthcare students by the end of this year, will be doing a 4-week module around global perspectives in their first year undergraduate unit. Okay? So because this is, we're working with and caring for an increasingly diverse population of people, and it's something that we really need to have a consciousness of. So today's session with me is going to hopefully be a bit of time for you to have a think about some of these things yourself, because in cultural competence, the first attribute of somebody who is culturally competent or working towards that is to be aware that they have their own, you all have your own worldview. And where did that come from? Who did that come from? It came from, you know, where you lived, who your parents were, your spirituality, your religious upbringing, you know, whether you were allowed to speak at the table in front of your father or not. It came from many, many, many things. So you have a world, you see the world through a frame that no one else sees the world from. Very similar frames, some people in your family, your friends, you know, things like that, but not exactly. Everyone has their own worldview. So it's important that you have a think about that. The other attribute is about reflect on what is your attitude towards diversity and difference. And sometimes we challenge students in this to be aware of things that push their buttons and make them feel uncomfortable. You know, cultural practices that make them feel frustrated or anxious, or, you know, typical, just recently, of a colleague in the north of the state had a patient who died, and they were Italian, so they had a lot of noise, a lot of relatives, you know, and the feeling among the staff was, oh, you know, what can we do? And she said, well, just let them get on with it. Fine. Because you have to think about what would be the point of not doing that. Knowledge and acceptance of cultural practices, and we put again a bracket around that of you don't have to like everything that's culturally different to your own worldview, but you accept that it exists and that other worldviews exist alongside it. And the big one that we work on is the skills in cultural competence, and that revolves mainly around communication. Okay, so all of these things that Annette has laid out here around setting the scene, when you have, or if you have a student whose second or third or possibly even fourth language is English, then you need to have a bit of a think about what all those things mean to someone who may not understand learning and teaching in a Western way. Because all of these values and our teaching, we operate in a Western society, we operate in a westernised health environment, and all these things are Western attributes, and how we might demonstrate them are Western attributes. So I'll get you started with punctuality. Now, who said that was their essence? That was you, wasn't it? Okay, punctuality, intensely Western, and in some Eastern countries as well, but in some African countries, it's not at all the most relevant thing. So my colleague who worked in South Africa as an English nurse, working with black South African nurses, running a clinic, running an antenatal clinic. 9 o'clock start, nobody there. So she's pacing up and down and saying, you know, 9 o'clock, where is everybody? And one of the nurses said to her, Louise, the time to start is when everybody's here. So the whole concept of time is Western. We watch the clock. We have shifts that start at and the other one is, you know, as a student, I haven't got your assignment yet, but I haven't finished it, says the student. Yes, but the due date is today at 5 o'clock. Yes, but it's not my best work yet. Okay, but I need it this afternoon because that is the due date. So then that needs, and it was talking about giving rationale. Okay, so sometimes with students and learners who are from culturally and linguistically diverse backgrounds, who might have a behaviour issue around punctuality, you might need to sit down and have another layer of conversation around, tell me about what being punctual means in your home culture. Now, I never say, well, where are you from anyway? Because what does that mean?
You're rude.
What's my body language saying? Well, and what am I saying?
You've got a bit of attitude.
Yeah.
Your culture's superior.
Yeah, that's right. So it's often, people often get that a lot in the supermarket, in the street, and that's different from saying, tell me about your home culture. Tell me about what time means in your home culture. Where do you come from like that is about, you know, well, you're clearly not one of us and you clearly don't belong here. Yeah, that's right. But I'm going to talk a little bit later about respectful curiosity, which is much, much better because people, students, and sometimes, don't forget, they're very young, they're very alone, and they're very worried about their English. They're very worried to speak in front of you and in front of patients because of their English. And so those are the sort of things that, those types of conversations that you can have. The other one is understanding the difference between teachers and learners in different cultures. Because we've said that we expect from students to ask questions. Now, in some learning cultures, that is not an acceptable behaviour. And in some cultures, you might be seen as the teacher, and it's your job to tell me everything I need to know. So, if you're my teacher, and you say to me, do you understand that? I'll say yes. You're nodding. So, and what does that mean? That means I'm not going to tell you if I don't understand everything, because you're my teacher, and if I don't get it, that makes you a bad teacher. And I'm not going to let you lose space because I don't understand. Okay? So that's a very, very important thing when you're teaching learners from different cultural backgrounds who say, yes, I understand. So what might be a better question?
Tell me what I have just said.
Yes.
Let's ask for a moment.
Yeah, tell me what I've just said. Tell me what I'd like you to do next. Okay? The thing about initiative, that's another thing that is, you know, very nuanced in our health environment and in English. Taking initiative. What does it actually mean? So sometimes you need to actually explain what that means in the particular context. So if you wanted a student to go and do a nutritional assessment on a person, you might, and you say, well, just use your initiative, you might actually need to say what we actually need to get out of this assessment are these 4 things. So have a think about how you might get that information, those things. Okay. The other thing is, when you're teaching or supervising learners from and that's a really good question to ask someone from a linguistically and culturally diverse background, is how many languages do you speak? And it's usually 3 or 4. It's usually the home language, plus a dialect, plus English, plus something else. And you think, well, how many languages do I speak? And that's, you know, that's admirable. And this student might be operating in their 2nd or 3rd language. And some students say to me, they ask me questions and want the answer straight away, and sometimes I just need another few seconds, because learners who haven't been learning in an English environment for a long time might hear something and it goes in and gets translated into the home language and then comes out in English. But in some languages, what you might say does not resemble what then comes out. And this is where I get, and Annette gets complaints about communication skills and students from diverse cultures, because people think they are rude. Because they might not say please and thank you a lot, because they might sound abrupt. So if I'm the and I say to you, the guy in cubicle 4, he's going to theatre, prison off, straight from the emergency department. I need you to go and tell his family what's going on, da da da. I hear that, I think, okay. I go to the cubicle and I say to the family, he's going to theatre now, in the story. Because the preambles that we like, we all think we're very laid back as Australians, but we love our manners, we love our please and our thank you, and if you've got time, could you? And I can see you're very busy, but if I want help now, and that's what I need, that's what's probably going to come out. Because in some languages, please and thank you are not used in everyday language. Okay? So if you want to help a student who you think is perceived as being abrupt or rude, then you say, now, when you're talking to a patient, so the patient said, oh, I don't know how to talk to that student because, you know, she seems like she's, you know, a bit abrupt. So you say to the student, so when you're talking to Australian patients, they like you to do it in a certain way and say, and introduce yourself and say, I'm going to ask you a few questions now about this. Is that okay? And if you turn over the page, you'll see something called solar. And sometimes, and I use this with Western students as well, because I've had, you know, a student who has not been willing to engage with a patient and has stood back like this while the supervising registered nurse or allied health person has been speaking to the patient, and the student appears very, very uncomfortable about engaging with the patient. So a really good question to ask at that point is, in your home culture, how do you greet? How do you greet someone senior? How would you greet, if your father brought an important business person home, how would you greet him, an older person? How would you, greet? How would you greet your mum? How would you greet your grandmother? And it will be amazing, the diversity of, because they don't all go, "G'day mate, how you going?" So our worldview, the way we greet is very different. So in some cultures, there's an 86-year-old person in the bed who's an older man. You've got a 17 or 18-year-old young woman from possibly an Asian country who does not feel comfortable engaging with that person. So you are not being racist if you're actually helping the student or teaching the student. I call it a survival kit. If you're going to survive in this Western environment and be assessed against the domains and the competencies that everyone else is, this is what you're going to have to do. Now I've jumped ahead, but I'll do it anyway. So solar. So you've got a student who's anxious and standing back and not engaging. So solar is a good one to teach. I'm going to demonstrate on you. Okay. So, and you demonstrate this. Demonstrate. It's very good for all students. Watch how I do this. Okay. So I'm going to sit here. Sit squarely. All right. Not here, and not too close. So you're teaching about body space and what's appropriate. Because our body space, you've all got your own space, haven't you? Last week or the week before, I did an exercise with students about, I put them into pairs and I said, walk towards each other until you get to a point where you feel uncomfortable. And it wasn't very close at all. It was like, stop. So, but that's Western, that's a cultural, learned worldview behaviour. Okay. So you sit squarely, open posture. So your posture is open, so you're not, hunched, arms folded, and you're not leaning back like this thinking, I'm really frightened. So you have an open posture, you lean forward slightly, you have eye contact, and you relax. Now, that is something that I've taught to some students, some Aussie students, some diverse students from diverse backgrounds. It works really well, and I teach it and they practice it, and I say, now do that to me. So that's a really good strategy if they feel uncomfortable, because some students from different cultures would never dream of sitting down when speaking to a patient. But then the patient says, I feel really uncomfortable talking to the student who's standing by the door and asking me questions from the door. I think she doesn't really want to talk to me at all. So then, using, going back to Annette's talking about rationale, it's about explaining the culture. It's about explaining not only, the Western cultures, but it's also about the healthcare culture. Okay, so another one. So I'm going back to where I was supposed to be now. For people from allied health, in the nursing competencies, we have something which comes under the banner of appropriate communication. Okay, and the prompt is that the student can initiate, conduct, and conclude communication appropriate to the context. All right. So when someone comes into theatre, you know exactly what that means. Hi, I'm so-and-so. I'm just going to do a quick checklist to make sure, everything's da-da-da-da. I'm going to pop you here. Here's your bell. If you need anything, just call. Someone will come to you. It should be about 5 minutes. Da-da-da, off you go. In your context, you know. In your context, you know what that means. Okay? You know what you're doing with your face, you know what you're doing with your voice, you know that if you're talking to someone who's just received bad news, you have a different look on your face and you have a different tone in your voice. And you might say to a relative, you need to come and talk with me now. And that's very subtle and nuanced, isn't it? And we know that, but it's a Western way of looking, and we know our face. So if you ask someone from another culture, and you sit down and you say, now, here's this competency, what does that competency mean to you? And that's when you can ask the question about greeting, because appropriately communicating and initiating conversation, for some particularly young women from other cultures, they would never dream of initiating a conversation because it's rude, or because it's too difficult, or because they've been taught never to do that, but be waiting until they're spoken to. So you've got to have a conversation about that. And it's not rude to sit down and say, so, tell me about your home culture. Do you all chat around the table? What sort of things do you eat? You know, it's being respectful. It's not the same as saying, well, here we do it like this, so just do it. You know, you start asking the questions, and the behaviour that people have been whinging about suddenly becomes evident, and it's easily fixed. Okay? So think about that, and if you have issues with a communication behaviour, solar is a very good thing to practice. And all the other good thing is for the student, for you to say, don't worry about doing anything for this morning, just watch me. Stand there and watch me. Watch my face, listen to my tone of voice, listen to when I'm a bit louder or a bit softer, when I'm speaking slowly, when I'm speaking more quickly. Again, with understanding students from culturally different backgrounds, particularly students from southern India. If you've ever had those, the more distressed and upset they get, the faster they speak. And it's very difficult to understand them. But they actually have extremely good English skills. So it's not rude to say, this is a good sentence. It's not saying, oh, for heaven's sake, slow down, I can't understand you, with that look on your face and that tone in your voice. But if you say, I'm listening to you really carefully, but please, could you just slow down a moment? Please, could you just speak a bit more slowly? Because if it's really slow in your head, it's fine for my ears. So that's another trick, is taking responsibility for being a poor hearer, in other words. So, and if you say, I'm listening really carefully first, but please, I say, could you just slow down? And then when they do slow down, you find that you understand every word, and then your face will go, yes, I understand everything now. And then the student is so happy. And then when you've established a rapport with a student, then, and they start speeding up again like that, and you go, ah, that's better, and it's really, really good. It's really, really good. And they know you're not, students know you're not being rude. They know that you're trying to actually assist them to be understood by their peers and by patients. Because you know, a lot of elderly patients, they're deaf, they see somebody who looks different. The student is anxious, so they speak very fast, and the whole thing gets completely out of hand. So those are some very good tricks. So I think of this as sort of as a survival kit. It's very difficult sometimes because you believe you might be trampling on a person's cultural rules and cultural upbringing. So you have to have a balance of that, and I always I speak it up. I say, I'm not trying to do that. What I want you to do is pass and be successful as a registered nurse or, you know, a dietitian or a social worker. And to do that, you need to learn to communicate in an appropriate way. So this is what we're going to do. Okay, here's a story. A student from a country in Africa, many years ago now, I had in the north of the state, I had this phone call. You've got to get this student off the ward. They're being so rude and he's clicking at everybody. And I said, what do you mean? Anyway, I said, okay, I'll come. And I got the student, a young man, to come and see me when I was out at the Newnham campus. And I said, James, who I knew, and I knew the student, and he was a very diligent student, very hardworking, very good English skills. I thought, well, what's the problem? And I said, what are you doing? He said, well, I had a patient who had chest pain, and I needed help immediately. And I saw the doctor and the nurse in the corridor, and I went up and I said, quick, I need help, quick, like this. In the corridor, you can imagine the consultant and the CNC. And of course, he was on exactly the right track. His patient was having chest pain, and he responded with his needing help immediately. I said, oh dear, oh dear, dear, oh dear, dear, dear. No wonder. So I said, so tell me why did you do that? Why do you do that? He said, he'd lived with his two young brothers in a refugee camp for about 12 years. And he said, there's thousands of people in the refugee camp. And if you want to keep track of somebody, or you need somebody in a hurry, that's what you do. Because they're all around you, and there's a lot of noise. So you have to go, hey, hey, like that. And it's confronting, isn't it? To get somebody's immediate attention. And I said, well, don't ever do that again, please. Or you'll never get a job. Because, and then I explained to him that is seen as being extremely rude in our healthcare culture, in our culture. We don't do that. Even if someone's got chest pain. So I said a good thing to do would be to go up to the person and say, excuse me, Mr. So-and-so has chest pain, please can you come quickly? Okay? So an alternative to the clicking was provided, and the student never did again. The student didn't say to me, you're a racist for telling me that. The student said, thank you, I'll never do it again. Now I understand that was inappropriate behaviour, I'll never do it again. So in all the years I've been mentoring and helping particularly international students and migrant students, nobody's ever said that they've not been grateful for how you help them. Because if you were doing something that was perceived as rude or something like that, you would want someone to tell you if you're passing a test. So if you're, I had a young Japanese student last semester who all semester in tutorials she didn't speak one word. And the last tutorial I said to her, we were having a final discussion, and she said to me, I haven't spoken, I cannot speak because I cannot call you Juliet because it's too disrespectful. I just cannot say it. What I want to say to you is Juliet Sensei, which is my teacher in Japan. And I felt like crying because I wished I'd known that in the very beginning. And honestly, her face, I said, well, call me that. I love it, actually. I want everyone to call me that now. Her whole face changed from, I thought, being either not understanding, of course she'd understood everything, she's a very, very bright young woman, was passing everything, all her assignments, everything beautiful. So now she knows she can call all her lecturers sensei, and that's lovely. And it's changed her ability to communicate. It's changed her ability. She now asks questions because now she can say, sensei, I need to understand this. Can you imagine just that one little conversation has changed that? Okay, any more stories from this corner? Telephone.
How to answer the telephone.
Okay, telephone. International students are remarkable at avoiding the telephone. As some others are, like if you were redeployed, you know, we're talking about redeployment, oh, I'm not answering the phone, I won't know what to do, you know, like that. So I actually do a lot of workshops in Sydney around, and I have people who answer the phone a lot at my workshops, like war clerks and other clerical staff from, many from southern India, and their accents sometimes. In fact, we refer some of them to speeches for accent modification because their accents are very, very thick and they're on the phone, which makes it 100 times worse, and that's their job. So students who are loath to answer the phone, they say, I'm worried about answering the phone because I don't know what to say. So I give them a couple of sentences, and I give a lot of people this sentence actually. And it's somebody rings up. Oh, hi. I want to know how my mother is. Response number one: I can help you with that. Not, well, what's your mother's name, or who are you, or well, you've come through to the wrong ward, or no, I can't give you that information, or blah, blah, blah. The first thing you say is, yes, I can help you with that. It doesn't matter what accent you've got, you can get that sentence out. And then, because you know when you've been on hold for 17 hours, speaking to a machine, here goes, your call is important to us, please hold, and you want to kill, smash the phone, or you get put through to a department and they say, oh no, we don't do that here, you'll have to call the council. You go, right, thanks very much. So then you ring the council, and the council says, oh no, we don't deal with that here anymore. We've changed our policy, and we now need to ring this person. You know what that feels like? Everybody in this room, don't you? You get the run around, and you go, for God's sake, will somebody just tell me what I want to know? That's all I want to know. So somebody comes along and says, yes, I can help you with that. You go, oh my God. Especially in healthcare. Somebody says, yes, I can help you with that. Just give me one moment and I'll go and find out. Oh, yes, I can help you with that. What's your mother's name? Yes, I can help you with that. Which patient are you referring to? So anybody comes on the board, they look at the board, say, who's that? No. What do we say? Oh, I've just come back from morning tea, I've just come back from lunch, been on days off, he's not my patient, you know, all of those things. Nobody wants to hear all that stuff. You say, yeah, I'll help you, just give me a minute and I'll find out. Easy peasy. And I was teaching some pharmacy students recently who were going into community pharmacy settings. And I had one particular young man from Nigeria who's now graduated. He's now a pharmacist. Very, very tall, 6'6", very, very, very black, going into a community pharmacy in Huonville. Our workshops there were slightly different because we talked to the pharmacists about people coming up to the counter saying, you got anything for the lurg, love? Or I've got the runs. What have you got for the runs? Or I've got a bit of the flu. You know, what do all these colloquial things mean? And he was very worried about how he looked, because he was quite big and and that's an unusual. He looked unusual for that particular area, which I happen to know very well. And I said, look, when anybody comes in and asks for anything, all you need to do is smile, because had a lovely, beautiful smile, and say, yes, I can help you with that. And then he said, but what if I don't know? I said, then you go and find out. So I said, I can help you with that. And the person goes, okay, thank you. Then you say, I just need to check with the pharmacist. So then you say, give me a moment and I'll check with the pharmacist. They're happy, absolutely happy. He's not said, I don't know, I'm just a student, which really annoys me. I'm just a this, I'm never, you know, not allowed. I just have to check with the pharmacist about that. Actually, funny, I did this myself. Recently I worked in recovery and anaesthetics part-time, which I used to a long time ago and went back to part-time recently. And I was in theatre and the patient was deteriorating, and the anaesthetist, I was in there stupidly, and the anaesthetist said, quick, go and get me this. I can't even remember what it was called now. I said, right, okay, I can do that. And I ran out, and I ran down the corridor, and I found the first person I could see. I said, what the hell is this? And they said, follow me, it's in the anaesthetic room. So I followed them to the anaesthetic room, and I ran back with them. I said, there you are. And they never had to say I was just an anaesthetist. I was just a part-time, casual this. I didn't know what he meant. And everyone was happy. So, and funnily enough, that particular student, pharmacy student, before he graduated, which he has now, he was driving a taxi part-time while he was still a pharmacy student. And I was on my way to the airport, and I was going to Sydney. And I got in the taxi, and I said, I'd had a terrible day. And I said to this guy, I said, can you just take me to the airport? And he said, I can help you with that. And it was the tall pharmacy student. And I said, I know. He said, you are the cultural competence lady. And I remember what you said. Oh, it was so lovely. And then we had this great chat about his reflection on his time in the community pharmacy. He said, you know, it worked really well. So it is a good sentence. So any time, you know, for any of your students, if you ever hear them say, oh, no, I'm just a student, or I'm just a this or that, say, no, don't say that. Say, I can help you with that. Just give me a minute, I'll have to go and check. Because the minute another human being hears the words that you're going to help them, that's it. You've won them. Even if the doctor can't see them for 4 hours, you can say, well, I know that's you want to see the doctor, but he's not available until 5 p.m. These are the options. You can come back, and then he'll call you, and off you go. I know he's not available. It's just different, isn't it? Is that it? Any more stories? Colloquialisms. Thank you.
Oh yes, we love those.
Okay, when you're speaking with students whose English is 3rd or 4th language, or 2nd or 3rd or 4th language, sometimes international students say to me, I learned English, but this is not English, I'm learning. So when you're talking with students whose English is 2nd or 3rd language, watch your colloquialisms. Watch your, you know, Australian, the Australian idiom, because we do it all the time and we don't even realise we're doing it. So sometimes it's important. In fact, my whole program started because a young woman from China in the 1st year of nursing went on her first practice placement, and an elderly woman asked her, she said she wanted to powder her nose. And the poor student came to me a week later in great distress because she couldn't find that in the Mosby's nursing dictionary. And then from then it grew that we've actually found 24 ways in the Australian idiom of asking to go to the toilet, depending on the age and the gender of the patient, and, you know, where they were brought up and their cultural upbringing themselves. So watch your, and if, you know, I do a workshop in Sydney where I have a guy who I do the workshop with, and about halfway through the morning he comes in and he's like got a script, and it's the plan for the rest of the day, but it's all in Australian idiom, like, you know, after smoko, we're gonna, I've forgotten all of it, but it's all in Australian idiom, and so we say, now that's the plan for the rest of the day, so what are we actually going to be doing? No. So it's conscious. Also, consciousness around your facial expression when you're asking those questions, because we talk about an open posture and respectful curiosity, and that's all about your tone and your face, and asking those questions. Yeah. So be conscious of your own, and sometimes, like PJs is another one. I've had a couple of phone calls about that. Other sort of things that we do, and imagine having English as your third or fourth language, and then Australian English, and then Australian medical nursing terminology, and idioms and slang.
You know, we were having this conversation yesterday. If we, you know, we want someone to give another a bolus of IV fluids, there's probably 20 ways of saying that.
How many ways of saying, you know, speed up the drip? How many ways can you think of saying that?
Chuck it through.
Chuck it through. Let it rip.
Full bore.
Full bore. Yeah.
Flat out.
Flat out.
Crack it on.
Crack it on. Exactly. See what I mean? So all of those terms we sort of are familiar with, and sometimes we need to think a bit about, what did I just say? And if you ask it like that with that nice look on your face, you can say, because I think I've just probably talked a bit of Australian. And sometimes, you know, like we lengthen our vowel sounds a lot, and people find that very difficult, particularly people from African countries who have very short vowel sounds. And again, I teach them, you know, they tend to say, I am your nurse today. They've got very shortened vowel sounds, I am your nurse. And the patient goes, eh? What are you? What are you talking, what? Like that. So I say to them, just in Australia, just lengthen your vowel sounds, because that's what we do.
A lot of Australians tend to put a or hey on the end of things.
Yes.
People think that they're always asking a question.
Yeah.
Every time you make it.
Because our voice goes up at the end,
Yeah.
like that.
Yeah.
Yeah. And so I teach them to say, I am your nurse. And they say, that sounds so ugly in my head. I say, I know, but so I write them words down and say, so if you have a student from Africa who can't be understood because of vowel sounds, that's a good thing. It's good. So write a list of words and get them to practice words. I mean, I'm a POM and I have no idea what Finnegan was, because it's Finnegan where I come from. You know, so it's true. It's like it is a different sort of thing. So ers. So the ers, lengthen the vowel sounds, are very good to help with language being understood from some people who have very short vowel sounds. Yeah. Okay. Any questions? Yes.
I was wondering if you could, I'd like some strategies. We don't get very many international students at all, but we had one young man whose speech was so poor that our elderly residents could not communicate with him or understand him at all, and even our nurses had difficulty. And I'm wondering, what strategies should we use when we get a student who can't communicate?
You're not an English teacher.
No.
That's not your job. So if you have a student who you think is unable to communicate in a healthcare environment unsafely, then you need to tell someone in the
It's
university.
difficult for him to learn from
Yeah.
our preceptors.
It might be that sometimes students need to come out of the course and do some English before they come back in. That sometimes happens. Because if a person doesn't have the English skill, that's different from things like volume and accent. If it's comprehension and actually, then yes, that is a problem, and you need to let the person who's in charge of that unit know, as in at the university. Anyone else? No? Good. Okay, thanks. Thank you.